Welcome to our deep dive, you guys, into the fascinating and I guess sometimes perplexing world of feline neurology.
Huh.
We're going to be focusing on
Absolutely.
recent study from the
Yes.
Veterinary Journal titled Tremors in Cats, 105 cases, 2004-2023.
Yes.
Ready to get into it?
Absolutely. This study gives us a great snapshot of what vets have been seeing over the past 2 decades.
So right off the bat, I was surprised to learn just how many cats were diagnosed with tremors in this study.
Yeah,
105. It makes you realize this isn't as uncommon as we might think.
that's a good point. It really emphasizes that paying attention to any tremors in our cats is crucial.
Right.
And what's fascinating here is that the study helped pinpoint the most frequent causes behind those tremors.
Okay, let's dive into those causes.
Yep.
The study highlights 4 main culprits, starting with what they call degenerative encephalopathy.
Right.
Can you break that down for us?
Sure. Essentially, degenerative encephalopathy refers to conditions affecting the brain, especially the cerebellum, which is like the control center for coordinating movement. When the cerebellum is affected, it can disrupt those signals leading to tremors.
So if a cat has a degenerative encephalopathy,
Mm-hmm.
is it safe to assume those tremors would be more noticeable when they're trying to move or reach for something?
You're on the right track. Those would be what we call intention tremors. Think of it this way. The tremor is triggered by the intention to move. Within this category, the study found that suspected cerebellar cortical degeneration and suspected lysosomal storage diseases were the most common types.
Interesting. Now the next culprit is feline infectious peritonitis, better known as FIP. It's a disease a lot of cat owners are aware of, but they might not realize can actually cause tremors.
That's right. FIP is a serious viral disease, and head tremors can be one of the symptoms likely due to inflammation in the brain.
That's definitely something to keep on our radar.
Okay.
Moving on to the third major cause, hepatic encephalopathy due to congenital portosystemic shunts, or HECPSS for short. It's quite a mouthful.
It is a bit of a tongue twister,
Yeah.
but in essence, it's a liver problem, where a shunt or an abnormal connection allows blood to bypass the liver's filtering system. As a result, toxins that should be removed end up circulating and can affect the brain, leading to tremors.
So it's like a detour in the liver's cleaning system that allows those harmful substances to slip through. That makes sense. And finally, we have intoxication as a major cause. Any surprises there?
Well, one thing that stood out in the study was the number of intoxications linked to Permethrin. It's an insecticide found in some flea and tick products that are not safe for cats.
It's a good reminder to always double-check labels and make sure any product you use on your cat is specifically formulated for felines. Even a small amount of permethrin can be extremely dangerous. Now, we know what can cause these tremors, but I'm guessing not all tremors look the same, right?
That's the burning question.
Yeah.
The study actually delved into the different types of tremors seen in cats, and it turns out there's quite a bit of variation, which helps narrow down the potential causes.
Okay, I'm all ears.
Yeah.
Tell me more about these different tremor types.
The study looked at when and how those tremors occurred. For example, they found that cats with cerebellar issues, like degenerative diseases, often have intention tremors, meaning the tremors are most noticeable when the cat is trying to perform a specific action.
So it's not that they're constantly shaking, but the tremor is triggered by purposeful movement. That's fascinating.
It is. And in contrast to those intention tremors, you have non-intentional tremors, which are present even when the cat is at rest.
Okay, so those might point to a different underlying issue? What about tremors that come and go?
Those are called episodic tremors. And the study even mentioned something called idiopathic episodic head tremor, where cats have sudden brief episodes of head bobbing with no other symptoms. We still don't fully understand the mechanisms behind it.
Wow, I never knew there could be so much variety in how tremors present themselves in cats.
And this leads us to another important consideration: the location of the tremors. The study found that the location of the tremor could be a valuable clue when trying to pinpoint the cause.
Let's talk about that in our next segment. It sounds like understanding where those tremors occur is another piece of the puzzle when it comes to diagnosis.
You got it. Join us next time as we delve into the significance of tremor location and how it can help veterinarians piece together the clinical picture.
See you then.
Welcome back. Before the break, we were talking about how the location tremors could help vets figure out what's going on.
Right, we were just getting into like where in the cat's body those tremors show up.
Right.
So let's unpack that a bit further.
Well, this study found that certain tremor locations were often associated with specific conditions. For instance, head tremors were commonly seen in cats with cerebellar disease, FIP, or even thiamine deficiency,
So if you see a cat with a head tremor, it could signal a variety of issues, and further investigation is definitely needed.
Exactly. And then you have what we call generalized tremors, which affect the whole body. These were frequently linked to intoxication or metabolic disorders.
That makes sense. If a toxin is circulating throughout the body, it could disrupt nerve function in a more widespread way.
That's the crux of the matter. And finally, limb tremors, which primarily affect the legs, often suggest a problem with the neuromuscular system, meaning the nerves and muscles that control movement.
So essentially, vets are acting like detectives, carefully observing the type of tremor where it's located and any other symptoms the cat might be experiencing.
That's a great way to put it. They're piecing together all these clues to narrow down the potential causes and determine the best course of action.
Which brings us to the topic of diagnosis. What are some of the tools veterinarians use to get to the bottom of these tremor cases?
Well, a thorough neurological examination is always the first step. This involves assessing the cat's reflexes, coordination, and overall neurological function. Based on those findings, the vet might recommend additional tests like blood work, urinalysis, or even imaging studies like MRI.
MRI, or magnetic resonance imaging, allows vets to see detailed images of the brain and spinal cord, right?
Precisely. It can help identify structural abnormalities like tumors, inflammation, or signs of degeneration. In some cases, the vet might also recommend an electromyography, or EMG, which measures the electrical activity of muscles.
So EMG can help determine whether the tremor is originating from a problem with the nerves themselves or the muscles they control.
Exactly. And let's not forget the importance of the cat's history. Asking the owner about the onset of the tremors, any other symptoms they've noticed, and any potential exposures to toxins is crucial for making an accurate diagnosis.
It sounds like a collaborative process with both the vet and the owner playing a vital role in getting to the root of the problem.
You're absolutely right. Open communication between the vet and the owner is essential for successful diagnosis and treatment.
Speaking of treatment, I'm sure that's what's on everyone's mind. So let's delve into the different treatment options available for cats with tremors.
Of course. But it's important to remember that treatment will vary greatly depending on the underlying cause of the tremors.
Okay, so let's break it down by those major causes we discussed earlier. Starting with degenerative encephalopathy, what can be done to help these cats?
Unfortunately, with degenerative conditions like cerebellar cortical degeneration or lysosomal storage diseases, there's often no cure. The focus shifts to managing the symptoms and improving the cat's quality of life.
So while we might not be able to reverse the damage that's already been done, we can at least make the cat as comfortable as possible.
Exactly. That might involve things like physical therapy to help with mobility medications to control seizures if they are present, and nutritional support to ensure the cat is getting all the nutrients they need.
What about FIP? I know there have been some promising advancements in treatment for this devastating disease.
You're right. There are now antiviral medications available that have shown some success in treating certain forms of FIP. However, the effectiveness can vary depending on the stage and type of FIP, and treatment can be expensive and may require long-term commitment.
So there's hope for cats with FIP, but it's still a complex disease that requires careful management by a veterinarian.
Absolutely. Early diagnosis and intervention are crucial for the best possible outcome. Now let's move on to HECPSS, that liver problem we talked about earlier.
Right, what are the treatment options for that?
The primary treatment for HECPSS, or portosystemic shunts, as they're sometimes called, is often surgery to close or reduce the abnormal blood flow.
So surgically redirecting that blood flow to ensure it passes through the liver's filtering system.
Exactly. But it's important to note that not all cats are candidates for surgery. The success rate can vary depending on the shunt's location and complexity.
So it's not a one-size-fits-all solution. What about medical management for those cats who aren't eligible for surgery?
In cases where surgery isn't feasible, or as part of post-surgical care, medical management focuses on reducing the buildup of toxins in the bloodstream.
Okay, so how do you actually achieve that?
It often involves a multi-pronged approach, including a special diet that's low in protein medications to bind ammonia, which is one of the main toxins that can accumulate, and supplements to support liver function.
So it's all about minimizing those toxins and protecting the brain from further damage.
Precisely. It requires careful monitoring and adjustments to the treatment plan based on the cat's individual needs. Now, for those intoxication cases, I'm guessing treatment depends heavily on the specific toxin involved.
That makes sense. You need to know what you're dealing with before you can treat it.
You got it. Identifying the source of the intoxication is the first step. Treatment might involve decontamination procedures like inducing vomiting or administering activated charcoal to absorb the toxin. Supportive care like intravenous fluids and medications to control seizures or tremors might also be necessary.
So it's a bit of a race against time to remove the toxin and prevent further damage. What about those less common causes of tremors we mentioned earlier, like polyneuropathies or thiamine deficiency?
Well, with polyneuropathies, which are disorders affecting multiple nerves, treatment depends on the underlying cause.
So if it's an immune-mediated condition where the body's own immune system is attacking the nerves, immunosuppressive medications might be used.
Exactly. And if it's a degenerative form of polyneuropathy, supportive care to manage the symptoms would be the focus.
And for thiamine deficiency, supplementing with thiamine is usually the key.
You got it. Thiamine supplementation, often given by injection, can help reverse the deficiency and improve those neurological symptoms.
It's fascinating how each of these conditions requires such a specific and targeted approach.
Absolutely. There's no one-size-fits-all treatment for tremors in cats. It requires a thorough diagnostic workup to pinpoint the cause and then a tailored treatment plan to address the specific condition.
This all leads to a very important point for cat owners. If you notice any kind of tremor in your cat, no matter how subtle, it's crucial to seek veterinary care immediately.
I can't stress that enough. Early intervention is key to giving these cats the best possible chance of recovery or effective management of their condition.
We've discussed treatment options for those common causes of tremors and the importance of early diagnosis. But what about ongoing research? Are there any exciting new avenues being explored in the realm of feline tremors?
Always, researchers are continuously working to understand the complex mechanisms behind tremors and develop new and more effective treatments. One area of active research is in gene therapy for certain inherited neurological disorders.
So potentially correcting the faulty genes that cause these conditions.
Exactly. While still in its early stages, gene therapy holds immense promise for the future of treating feline neurological disorders.
That's incredible. Another area I'm curious about is personalized medicine. Are we getting closer to tailoring treatments to an individual cat's genetic makeup and specific needs?
Personalized medicine is definitely gaining traction in veterinary medicine. We're seeing advances in genetic testing that can help identify cats at risk for certain diseases or predict their response to certain medications.
So a more precise and targeted approach to treatment.
That's the goal. By understanding a cat's unique genetic profile, we can potentially tailor treatments for optimal efficacy and minimize side effects.
This is all very promising. Sounds like the future of treating feline tremors is filled with exciting possibilities. Speaking of unlocking secrets, this study mentioned that some tremor types, particularly neuropathic tremors linked to nerve problems, are still not fully understood.
That's the burning question. Further research is needed to unravel the complexities of these tremors and develop more targeted therapies.
So while we've come a long way in understanding and treating tremors in cats, there's still much to discover.
Absolutely. The feline nervous system is a fascinating and intricate network, and ongoing research is crucial to continually improve the lives of our feline companions. From Vet NeuroJar, keep those minds-inspired hearts light and tails wagging.
You know, we've covered so much in this deep dive about tremors in cats.
It's been quite a journey through the complexities of feline neurology, right?
Oh, it really has. And I think what stood out to me the most is that tremors aren't just some random twitch or shiver. They're like a secret language from the nervous system saying, hey, something's wrong.
That's a great way to think about it. As we've discussed, the type, the location, and even the timing of the tremors can give us hints about what the underlying cause is.
Right. So it's not about just seeing the cat tremble. It's about really breaking down the tremor itself and kind of getting to the bottom of it.
Precisely. And that's where the skill and expertise of a veterinarian are so important. They're trained to decode all those subtle signs and use a mix of things like the clinical examination and diagnostic tests along with the cat's history to get to an accurate diagnosis.
Speaking of diagnostic testing, this study highlighted the importance of using things like MRI and electromyography to evaluate the tremors.
Right.
Can you remind us how those help vets figure out what's going on?
Sure. MRI, or magnetic resonance imaging, gives us detailed images of the brain and the spinal cord. This can help identify structural abnormalities that could be contributing to the tremors, like tumors, inflammation, or degeneration.
So it's like getting a snapshot of the nervous system and saying, okay, are there any red flags here?
Exactly. Electromyography, or EMG, measures the electrical activity of muscles. This helps determine if the tremor is coming from a problem with the nerves or the muscles they control.
So if the nerves aren't communicating properly or the muscles aren't responding right, That could be causing the tremors.
That's the crux of the matter. These tools, along with a neurological exam and the cat's history and symptoms, give vets what they need to diagnose the cause of tremors.
It's amazing how far veterinary neurology has come. We're able to figure out these mysteries and provide better treatment for our feline friends.
It really is. And as research continues, I think we can only expect more progress.
This has been so informative. I feel like a lot of cat owners don't realize how complex this topic is. But I think one of the biggest takeaways is that tremors are serious and shouldn't be ignored.
I couldn't agree more. Early detection and veterinary care are the most important things for the cat.
And it's important for cat owners to know they play a huge role in this too.
Absolutely. Vets depend on the information that the owners give them about the cat's behavior changes in their health and their history.
So don't hesitate to share everything with your vet, no matter how small it may seem.
Right. And in turn, vets need to educate owners about their cat, the condition, the treatment options, and how to care for them at home. It's a real partnership.
Well said. This deep dive has really shown me how complex feline tremors are and how dedicated veterinary professionals are to helping these cats.
It's been my pleasure sharing this information. And always remember, if you notice any tremors in your cat, don't wait, get them to a vet right away. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.